And thank you to all the members of the committee. My name is Agnès Germain. I am the Assistant Executive Director of Hope and Change for Haiti. And I'm here for two reasons, because as a woman who gave birth in the state of Rhode Island, what I experienced during birth, and I want some of the women that come to the United States, like immigrant, like don't speak English and have a better outcome that what I experienced. And the second reason is because of the research and the report I read. Maternal mortality and morbidity becomes a public health crisis in the United States, and this is unfortunately affects Black women particularly. Black women, unfortunately, they are 3 to 4 times more to die during birth than white women. This is really stunned me. This is really unacceptable in the 21st century to see how Black women continue to die during labor because of pregnancy-related complications. And most of the time, it's because their voice not heard, because there's no one to understand what they need. They die after labors, they die a few weeks after labor, they die during labor, and sometimes that could be preventable. So I'm here to ask you, please, because there's a lot of already said, I don't want to repeat that, but I'm here to ask you, please, to vote yes. To vote yes to S0678. This bill, Doula Reimbursement Act, that will offer coverage on the Medicaid and private insurance for all women, regardless of the income. So in Rhode Island, there is no legal provision that provides for any woman to have access to doula support. And some of the providers who can offer the support, not all women can afford that. And not only that, there is some providers, they don't make enough to make a path through the profession of being a doula. Not only we don't have enough doulas, but they don't pay enough to encourage other people who want to do doula services, who want to become a doula provider, to get into this profession. So we can save life. And report shows that any woman who experiences doula services during pregnancy, labors, and after labors, the postpartum period, they experience better outcomes. So we can save life if we do something. So we can close the gap between white women and Black women that experience the death. So Black women, we see this a huge disparity. It's a huge health disparities between Black women and white women. And we can stop the cycle of death between Black women. And I think you can do that. Women's life shouldn't be at risk when it's come to carry a pregnancy to terms. It shouldn't be at risk. And I think we can change that today. We can vote yes to S0678 to give a chance to all women in Rhode Island to benefit, to have access, equal access to quality care. That's what we need. And as we will celebrate next month, Mother's Day, this is a big gift to give to all women in Rhode Island. A gift to say, I want to have a baby, but I know the condition in which I will have this baby will be much more better. And we can do that. So I ask you, please, to vote yes, and you make the right decision to give all women, Black women mostly, that been suffered with such disparity a chance to benefit and to celebrate Mother's Day anytime. Thank you so much.
Any questions? So I want to explain one thing to everybody in the room, is that this is initial hearing. We already came up with a few considerations for how we would revise the bill, and all those efforts would be in the service of trying to eventually pass this. But seeing as these are initial hearings, we're actually going to hold for study every bill that we hear today. That doesn't mean it's dead, but we won't be voting yes today. So
Not today.
I don't want you to hold it against us that we won't be holding it. Because
I want it so badly. I want to see it so badly.
because Hope and Change for Haiti,
Yes.
Rhode Island is a better place because Hope and Change for Haiti is in Rhode Island.
Oh, yes, it's a better place.
And
You know,
I'm very familiar with the organization, and I'm
Thank
really
you.
proud that I've been
Thank
able
you.
to know about them. And
yes, thank you so
Yeah.
much for all your support
yeah,
as well.
yeah, and so we're all better off for Hope and Change in Haiti and Rhode Island.
Yes.
And you did a great service by coming up here and testifying on this legislation.
I have to be here today because
Yeah.
as our organization, we have a focus on women's rights. So we want women to benefit their rights fully. And right to health care is a right for all women, and mostly Black women. Any woman have to have the right for health care. And that's why I'm here. Thank you.